Welcome to this, I think it's the 7th lecture in the Here's to Your Good Health series, sponsored by the Pender Island Healthcare Society. And today we have a local, Dr. Trevor Erikson, who's going to speak to us. Now, Trevor, I always thought that I spent a lot of time training before I got my first job, right? I graduated from medical school, from high school in '61, and I didn't really get my first paying job until about 13 years later, right? After going to undergrad, medical school, residency. But Trevor got his first degree in non-traditional medicine in 1990. And really his first job in 2015, is that right? So talk about long training. So he'll tell you a little bit more about that pathway. But he is an expert, a recognized international expert on the use of Chinese medicine, specifically for skin disease. But he's also dabbled in other things. Like he just told me that for a while he was dabbling in treating infertility, because he thought maybe he and Jillian could make a powerful pair, right? He would help him get pregnant, she would deliver the babies. What a combination. So, but they haven't started that business yet. So he's gotten more into inflammatory disease, and we're going to hear his journey and some details. So we look forward to it. Thanks. Take it away, Trevor.
Well, the last time I taught a lecture here, I think was maybe 2018, but that was the other hat I wear on Pender Island to be as a gardener. So I taught a talk for the garden club, and so it's good to be back. This is actually the first live lecture I've done since before the pandemic. The last professional talk I did was 2019 in San Diego for the Integrative Dermatology Symposium. They brought me down to talk about, mostly Western dermatologists brought me down to talk about Chinese medicine treatment of chronic skin disease. So I might be a little bit sweaty and nervous because I'm a little bit rusty. I don't leave my garden very often, but I'll try to go through this. I put a little bit of a controversial title, and I've already got a bit of flack for it, but I just want to explain. I put treatment before steroids. I don't want to say that I'm against steroids. I hope people don't take it like that. I really do think steroids save lives. They're incredibly good medicine. The problem exists, and most people who've worked in medicine long enough will know, is when we overuse and misuse them, then we get into trouble. And I just want to look at, well, what do we do? What are other options that exist? You know, inflammatory disease is not new. We've had inflammatory disease as long as we've been human. And there's other cultures that have learned other ways to deal with that. And I'm going to share some of that today. And we'll go through. Oh no, I don't have the thing.
Oh right, I'm the one who's I have a job, right. Sorry. I knew I was supposed to be doing something.
Okay. So what is Chinese medicine? So, you know, Chinese medicine, a lot of people might not realize, is the second largest medical system in the world. It's massive. You know, we're talking, practice in almost every country of the world. In a very large way, and through all walks, from every specialty you can imagine, from young to old, Chinese medicine has a role there, and so we'll talk a little bit about that as we go through. It's a scholarly medicine, so I put that meaning it's different than a folk medicine. So folk medicine typically is kind of like what our great aunt said, when you get sick, take nettle tea or something like that. It's more through word of mouth. That's folk medicine. Scholarly medicine means they wrote it down. So in China, they wrote things down since, probably 2,500 years ago, and in great detail, talking about, okay, this is a disease that we figured out. This is what this disease looks like. This is why we think it's happened, and this is what we think a good treatment is, and this is what the outcome was. So Chinese medicine is very much based on case studies. Thousands and thousands and thousands and thousands of documented case studies over 2,000 years. I mean, it would take, one doctor multiple lifetimes to even read through all the material. There's so much. So that has a tremendous weight in terms of how we practice today. When I trained in 2005 in the hospital in Changsha, China, in Hunan, and in that province, they have the Ma Wangdui tomb, which is very old tomb that they uncovered in the 1970s. And it was buried somewhere around, 300 BC or something. And everything in it was immaculately preserved. And it's a very humid part of China. So they were surprised it was, everything was preserved so well, including, a woman mummy who still had her lungs intact. To have her lungs intact over so many, thousands of years is pretty incredible. But in this tomb, they had herbal medicines in there as a time capsule, and I remember going through the museum, looking at it, and telling my translator, I'm like, oh yeah, we still use that medicine, I still use that medicine, I still use that medicine. So there's a long history of use of these herbal medicines with thousands and thousands of case studies. So this isn't something, brand new. It acknowledges plurality. So Chinese medicine, if you talk to 10 different Chinese medicine doctors, you might get 10 different opinions. And in the West, we tend to go, oh, no, it can't be real medicine if people disagree. But I guarantee if you talk to 10 different GPs, you'll get 10 different Western GPs, you'll get a lot of variance in how they look at it. The difference is in China, it's accepted that, so what'll happen often is if, grandma is ill with something, that's quite bad, they might interview 10 different doctors and then have a family meeting and go, okay, who do we think has the most experience and knowledge, seems the most confident, and then they can choose. So I think that's a really important point to add in there. It's a synthetic medicine, meaning it is an evolving medicine even to this day. From, if you look through the history of Chinese medicine, you can find, say old paintings where there'll be like, someone from India all dressed up in all these fanciful clothes, giving a gift of herbal medicine to someone in China, and with that gift, they're accepting this other medical knowledge, new medicines, new diagnoses and treatment ideas, and that's continued right up to the current day. In such that, what I do is not something that is just, what a doctor did 2,000 years ago. I'm practicing. It's a living medicine. It's happening right now, and what I'm going to talk today is it will show that. I'm going to talk a lot about the microbiome, which 2,000 years ago they wouldn't even had a clue existed. And so it's a very, Chinese medicine is evolving medicine, just like Western medicine. It believes in holism, meaning we'll use the whole plant and all of its, the things within it, rather than just extracting out one chemical from that plant. And as we go through, we'll see more reasons as to why that is a good thing. We run into a lot of problems when we isolate one. It's really easy to study in science, to study one molecule on how it affects one receptor in the body, but maybe that's not the best way to get long-term health achieved. And then our treatments are vast. They're always geared towards restoring balance. And what I mean by that is not dependency on medicine. So no matter how chronic or bad the disease may be, we're always thinking, how can we get them to a place where they don't need medicine, rather than you're going to have to be on medicine for the rest of your life. You may be on medicine for the rest of your life, but that's not the goal. We're always trying to achieve this kind of idea of homeostasis. So that could include counseling. It could include diet, lifestyle, exercise, acupuncture, massage, and or herbal medicines, okay? So lots of things in the toolbox. And then I have there, what can Chinese medicine teach us about the management of inflammation? Oh no, it's you that changes. I put this quote here. So another thing a lot of people don't understand about Chinese medicine is that it's highly specialized and has been for a long time. So this quote is from like 250 BC, and basically what it's saying is, if someone comes in and they have a skin disease, they'll see their GP, and the GP will be like, oh, I think you need to see this so-and-so because they have more training and experience in the treatment of this. So this idea of referring on to someone with more knowledge and expertise has always existed in Chinese medicine and has even to the current day. So when I trained in the dermatology ward in China in 2005, I followed one doctor, and every day we saw, 60, 70 people, 6 days a week, and the majority of them all treated with herbal medicine. So, and the other cool thing on here is, people talk about that ancient Chinese medicine was based on on getting results. So, you know, in that world in 250 BC, the physician actually looked at how their patients do for that year, and that's how they got paid. It's a very different system. And so they didn't get results, they didn't get paid. So you can change the slide. Okay, so what is inflammation? You know, I think there's a lot of people know, but there's also a lot of people that don't know. It's become kind of a dumb thing, like, oh, I'm really inflamed, but really don't know what does it mean. Inflammation actually is really good. We need inflammation. Inflammation is our body's way to protect itself against harm. So if you take a bee sting, for example, you know, this bee penetrates your skin, it makes a wound. With that, it puts a toxin into you. And then with that open wound, you may have the opportunity to develop an infection. So your immune system, through inflammation, is going to do several things. It's going to try to get that toxin out of there. It's going to try to prevent and treat any infection that might occur. And it's going to heal the wound. And so there's a lot of things going on there. And so we need it. It's not a bad thing. If we didn't have inflammation, we would all have perished a long time ago. Okay, next slide. Where it gets problematic is when this inflammation doesn't turn off. So, you know, we get an infection, we get a bee sting. Like I had a patient once who got a leech bite in Thailand, and then that turned into full body, you know, what we call discoid or nummular eczema that lasted for a decade after. So that initial infection triggered off this event where his immune system just kept going. And so one part of the immune system gets ramped up, and then we call that chronic inflammation. So that could be anywhere. It could be your joints, it could be your skin, it could be your lungs, it could be your digestion, your intestines. But basically the idea there is that one part is not turning off. It's like it just keeps going. And that is the root for many diseases. So in other words, you know, chronic inflammation is like the light switch is broken. You know, you get ready for bed, you turn the light on, you get ready for bed, get into bed, read your book, and then you go to turn the light off, and it won't turn off. You're like, what is going on? And so that's exactly what it is. It's more, chronic inflammation is more about a regulation issue. The body's not regulating itself properly. Next slide. So here we're going to get into some of the modern issues. So over the past 60 years, unfortunately, we have seen a massive increase in inflammatory diseases of all sorts. You know, pretty much all chronic inflammatory disease has been rising, some of them quite tremendously over the past 60 years. And we're going to talk about some of those reasons as we go through. Here's some, you know, common diseases that we link to inflammation. So all the autoimmune diseases, rheumatoid arthritis, skin diseases, atopic dermatitis, which we'll talk about today. Heart disease is considered and cardiovascular disease is considered a chronic inflammatory disease. Certain cancers, inflammatory bowel disease, Crohn's colitis, asthma, chronic COPD, mental conditions, obesity, type 2 diabetes, and even some neurodegenerative diseases are all could be associated with chronic inflammation. And all of them have been rising over the past 6 years. So take two, for example. In 1972, they started to track a little bit in Quebec the rate of inflammatory bowel disease. And it was around 6.3 people per 100,000 people in 1972. I was 1 year old. And last year, there's 843 per 100,000. That's prevalence. That's ongoing disease. By 2035, they're expecting it to be more than 10% of the Canadian population suffering with IBD. And that's obviously not a good thing. And so, you know, we'll look through some ideas as current thinking as to why that might be happening. Same thing with atopic dermatitis, or actually all allergic disease. Asthma, I'm pretty sure has risen a lot in the last 60 years. Is that correct?
Yep.
You know, food allergies. I think the first documented case of peanut allergy was like the late 1960s. And now it's like, you know, when my kids first went to school here, they weren't even allowed to bring a peanut butter sandwich to school anymore. I mean, it's a thing. And it's risen to around 25% of our population suffers with just atopic dermatitis. So everything has been going up. And Canada actually has some of the highest rates of inflammatory bowel disease in the world, which, you know, shocked me when I learned that statistic. So our modern treatment, again, this is about steroids. That, steroids since the 1960s, when they kind of first became really popular, that any doctor could use them. That's been our main medicine to manage inflammation. It's a suppressive medicine, so it gets things down quickly. It can be effective, and really create, really get things under control. The problem with it is that it's easy to become dependent on it. So people are often on it for many years duration, and that balance of not using too much for not too long and getting side effects and coming off of it can be, when you become quite dependent on it, can be quite a challenge. And I'll talk about some of those cases later today. Dependency. This is actually from the UK government. This was a warning about topical steroid withdrawal, which is, withdrawal means their skin has become totally dependent on it. When they take it away, especially if they take it away really fast, crazy things happen, which mostly is that the condition is worse than it was before. It's affecting larger parts of the body, where maybe it was a small area, now it's the whole body. And we call that TSW. Other people call it rebound effect, but it's a true dependency that really needs to be respected and understood well. And we are really just starting to understand that now. After 60 years, it's becoming more common that we're understanding that in all walks of medical profession. Okay, next slide. And this is same for, so oral, this is new, coming out in the last 10 years for the treatment of inflammatory bowel disease. It used to be the first line was, if you're having a flare of inflammatory bowel disease, colitis, is to be put on prednisone, internal steroid. But now they're finding more and more, actually just that one course of steroid will increase the risk of you being on immunosuppressive medicine for the rest of your life. So it's they're really re-looking at this idea of what steroids being good, but when and where, and learning how to respect them. Okay, next slide. So suppressive medicine, with the light switch idea, it's like just putting a blanket over the light. But it's not fixing the light switch. That's the main point that I wanted to make. Is I took that picture. That's actually, my mom made that quote for us, Julie and I, for our wedding. But that's exactly what it's like. It's, I always say, if a steroid is great, if you use a steroid and your condition goes away after a week or 2 weeks or whatever, and then you stop the steroid, it stays away for the next year or so, wonderful. I would never be against that. But what we find is in a lot of these chronic inflammatory conditions, it doesn't go away. After 3 days of stopping, I need to use it again. And they just keep having to keep using it and using it. And now 2 weeks has turned into 20, 30, 40 years. And I've seen that a lot. So again, we need to fix the light switch, not just focus on the other way.
Oh, sorry.
So here's an interesting fact. So all of these things over the past 60 years in our Western world, in Canada, all this chronic inflammation is going up and up and up. But actually, in developing countries like China, they didn't see that. When they started to see chronic inflammation increase in a rapid way was when they adopted our diet. And what is the Western diet? Next slide. In Canada, unfortunately, it's almost half of our diet is ultra-processed food. And ultra-processed food, in my opinion, is not food. It's been mechanically industrialized. Things are separated out, put back in. They have psychologists, working for them to make it more addictive. It's mass marketed. They have all these advertising campaigns to make you think that it's good because it says, it's got extra protein in it or something like that. But the reality is, more and more and more studies are coming out showing that what we call UPFs, or ultra-processed foods, are not good for us, and they should not be in our diet, especially in children. Children are the most susceptible. Their bodies are learning and growing, and if we mess with it, we may be setting them up for chronic inflammation throughout their whole life. So they did some studies. This just came out in June of 2024. I'm reading my doctor notes now, my slide notes. 2024, a study came out in the Journal of Nutrition showing that pregnant moms who have a high amount of UPFs, ultra-processed foods, in their diet had a twofold increased chance that their child will develop allergic disease like atopic dermatitis. So these rates have gone up. We used to blame everything on genetics. And we used to even think that about Asia. We thought, well, it must be just the European genes. That's why they're not getting all this inflammatory disease. But that's been ruled out now. It's not, because when you see Asians come to North America and eat our diet, they get the same rates. And now we're seeing that it actually starts in the womb, and that baby's really susceptible to all of this. This is what I grew up. I grew up on Fruit Loops. That was my morning cereal, in the 1970s. Ridiculous. But so here's another fact I put here. So the rise in inflammatory disease, the widespread use of all of this non-food, and the use of steroids. So steroids became available to most GPs around 1965-ish, somewhere in there. And all of those happened at the same time. And so, it's not to blame the steroid for the rise in the inflammatory disease. It's more to say that actually the steroid is more like, as my first herbal teacher said, it's like if you have a dirty garbage can that is full of stank and flies, one way is just to keep spraying it with Lysol, deodorize it. Whereas instead of actually going, okay, clean it out and what's really going on in this garbage can. So the steroid is kind of like the Lysol. It's just trying to okay, this is a problem. These people are suffering. Here's some good medicine that is going to help them. But not looking at why. Why are we getting these rates? And so more and more and more is coming back to our diet and other things. I mean, obviously, environmental pollution is a big part of it. Increased stress, and we'll talk about some of these things as we go through. But ultra-processed foods, in my opinion, are the biggest culprit, and that's the one where we can see a direct link when that enters into developing countries where we see increase of disease. So we're going to switch now into what these UPFs are doing, and this means looking at our microbiome. So when I first started working, I first started working as a Chinese medicine doctor at the health center here in 2005. That was the first place I started practice. I remember talking to one of the GPs there. I'm not going to say anybody's names. Yeah, they don't even live here anymore anyway. But I remember having a conversation in behind, in the lunch area. We're just chatting, and he said, I get these patients that come in, and they're not well, but they really want something. They want to go home with a medicine. So I just give them 5 days of antibiotics. It's not going to hurt them. And then it was less than 2 years after that, you could go to Vancouver in the back of a city bus. It will say, antibiotics are not for the common cold. So, that was a massive campaign that happened all across the world, really, was to go, actually, antibiotics are not benign. They can do damage. We're seeing, increases of disease. We're getting antibiotic resistance, all these things. We didn't really even understand the role of the microbiome at all. We just thought, they're just whatever vagrant tourists that are hanging on to us, that they have no function in our body. But that has really been demythed. That we are realizing actually our microbiome, which is 57% of us, more than human cell, is really what is giving us good health. Without them, we're nothing. Meaning, we are a symbiotic human. We're a community, a walking community of other than just human. And so we have to respect them. We have to respect our biome. Ultra-processed foods, being non-food, they really damage the microbiome, particularly of the gut. They really deplete the numbers. The more diverse and the more numbers of bugs that we have in our gut, it has been associated with better health. When we take antibiotics too much or any kind of medicine that might influence that microbial balance, eat foods that might influence that microbial balance, we set ourselves up for chronic inflammatory disease. Okay, next slide. So we talked about this a little bit. So when it's so one of the things that the microbiome do is these little critters in our gut, they digest food. They digest food that we eat, particularly fiber and polyphenols, which I'll touch on. And then they create chemical compounds that actually we use to regulate our immune system. And so if our bugs aren't doing that, then our own ability to regulate our immune system is going to be compromised. So we call this imbalance in our microbiome dysbiosis. And again, it's correlated with most of the chronic inflammatory diseases that we've seen on the rise. So asthma, atopic dermatitis, obesity, diabetes, cancer, inflammatory bowel disease, depression, and the list goes on. Next one. So here's some common causes. So again, antibiotics, anything that's going to wipe out all that balance. Smoking, overuse of alcohol, environmental toxins, air pollution, hazardous waste, microplastics, emotional stress. We know stress can influence the microbiome and the immune system because it's pumping out too much cortisol. And cortisol has a very, as we know with using cortisol as a medicine, it has a immune lowering ability. So it will really impact us. Lack of physical exercise, poor sleep, and our food choices, lack of fiber, ultra-processed foods, again. So it's kind of thinking about ourselves as an old-growth forest. This is from Shel Neufeld. I don't know if anybody knows Shel, but he's one of my best friends, and he took this nice forest picture. You know, it's a thriving community. There's so much life there, and they're all supporting each other. No one is getting out of hand, and everything is keeping each other in check. But we know, next slide, when we clear-cut it away, what happens? We get mudslides. We get the soil heating up too much and cracking and drying out. We have species just dying away like mad. And then we allow for, invasive species to take hold. It's the exact same thing that happens in our body. We are the same as an old-growth forest. So the microbes in our body, the main food for them. So the main microbiome that I'm talking about is more your lower intestine. It's the part where they used to think just kind of firmed up your bowel, which is what they thought fiber was only good for. They thought you need fiber to firm up your bowel, and then regulating water. That's all they thought. When I first started studying medicine in the early 2000s, in 1991, like that's what I was taught, even in studying natural medicine. But as we learn more, we learned actually these microbes are doing a lot for us. And so they take that fiber that we thought was just firming up our bowel, they actually ferment it. They take polyphenols. Polyphenols are what give plants their color, their aroma. They're like defense mechanisms for the plant. They can actually process those, take chemicals out of them, which have a profound effect on our health. And we'll talk about that as we go. Next slide. So here's a bit more. So again, I just said fiber, the microbes ferment fiber to make short-chain fatty acids. These short-chain fatty acids have anti-inflammatory, immunoregulatory, anti-obesity, anti-diabetes, anti-cancer, cardiovascular protective, hepatoprotective, neuroprotective. They have a lot of good things that are happening from something we thought was just firming up our bowel. And here's one. So this is one that they've recognized recently, which is a short-chain fatty acid, which is made from our gut microbes fermenting fiber, which is butyrate. Butyrate is an interesting compound in that it is like the light switch for our immune system. So if our inflammation is going too crazy, butyrate can go, no, you're getting out of hand, and it is actually, helps bring it down. So we could look at butyrate as like being the peacekeeper. So if you don't have peacekeepers, you just have full-out destructive war, right? And you need peacekeepers on the planet and in our body. And so that's just one example. There's like thousands and thousands of these things happening to us all the time, which is why it's been so hard to study. So, there's an invasive plant that happens after a clear cut, but it's actually really good for us, which is a blackberry. So blackberries actually are really high in fiber. So if you eat the seeds in blackberry, it's one of the highest sources of fiber that you can get. That and raspberries are two of the highest sources of fiber in terms of fruits. But they're loaded also with polyphenols. So again, polyphenols are the chemicals making the blackberry black or purple or whatever color. It's giving it that taste. Polyphenols are, again, there's thousands and thousands of these polyphenols. One of the ones that come out of blackberries is coumarin, which again is found to be antioxidant, anti-inflammatory, anti-tumoral, antimicrobial, antiviral, neuroprotective. If we don't have a healthy biome of these bugs, this diversity of bugs, taking in these polyphenols, these fibers, if we're not eating those kind of foods, then we're doing our body injustice. We're not getting what we need, and hence why we're going to become dependent on a medicine, like a steroid or any other, is because we're not allowing our body to do the job it is supposed to do. And that is have a relationship with the world around us, eating more plants, and understanding that we're not just feeding a human, we're feeding a whole community. Next slide. So this is all from my garden. That's Jonah when he was probably 4. And the idea there is, this is actually based on, Dr. Tim Spector. It's the idea of inflammation prevention then is eating, a plant-based diet, which really is, a traditional Chinese medicine diet. It's actually a Mediterranean diet. A lot of traditional diets are plant-based, and they were not only plant-based, but they were very diverse. So Dr. Tim Spector is an epidemiologist in Britain who's now become quite famous. He's done a lot of studies on nutrition, studies on twins. They did all these studies during COVID looking at nutrition and COVID outcomes. They're the ones who first recognized that loss of smell is one of the first symptoms of COVID. So that was through his work. But what they found, so they do all these studies where they look at the microbiome on a regular basis, see what's influencing, how it's changing, how that correlates into your blood sugar levels, all kinds of cool stuff. I would recommend anything written by him. He's got really interesting ideas. But these are some tips that they came up with of how to prevent inflammation through your diet. So eat a diverse range of plants. So what they found is the sweet spot is at least 30 different kinds per week. And so 30 different plants. So that could mean an almond. It could mean a pumpkin seed. It could mean actually just putting some basil on your food, okay? But of course, corn and lettuce and eggplant, all these kind of things. You want around 30 per week. And they found if you get at least 30 different types of plants per week, that you're going to have a really thriving, happy, diverse microbiome, which is associated with good health. Okay, so these are studies based on thousands and thousands of people. Eat the rainbow. So the idea there is color. Polyphenols are what give plants their color. So if you're eating a wider range of color, from purple to yellow to red to orange to dark green to even white, you are going to get a wide range of polyphenols. And we know that those polyphenols are giving us a lot of really good things in terms of regulating our immune system and keeping inflammation down. Whole grains, beans for the fiber. Again, that fiber is not just to bulk up our bowel. It is actually feeding the microbes so they can produce medicine for us to keep us healthy. Fermented foods. So, the fiber you can think of being like a prebiotic. They're giving food to the bugs to grow. The probiotic is where we actually eat the bugs. And so fermented foods have traditionally always been the best way. Sauerkraut, kimchi, yogurt, kefir. Kefir, I just learned, has something like 10 times more microbes than yogurt. So now we do both at home. We have yogurt and kefir together. And limit your intake of UPFs. Keep your junk food down. So this is an old quote. So Sun Tzu Miao, around, we call the Tang Dynasty, 600, and he was 619 to 907. That's not right. He didn't live 300 years. Oh, because that's the Tang Dynasty. That's not his age, but he's in that period somewhere. He's kind of like the Hippocrates of Greece. He's the one who sets the ethics for Chinese medicine in a big way. Saying things like don't think about someone's wealth or social status. If they're ill, you got to just treat them. And he set the kind of the bar for how to practice ethically. He's famous for this quote as well, which is, those who practice medicine must first recognize the origin of the illness. They must know which violations have caused the suffering. Then they must treat it with dietary means first. If dietary therapy does not cure the illness, only then can they employ drugs. So it's a very interesting way. And that's what I find, we can learn a lot of that in our Western model. If someone comes in suffering, so many times they just take this. How many UPFs are you eating? Is 50% of your diet UPFs? Well, maybe you should be looking at that too. I'm going to give you medicine still because you need to stop suffering. But in order for us to get a hold of this in the long term, we really need to be looking at the bigger picture. Next slide. So I got a couple other in here. This is a great image. I love this image. Exercise and movement has really declined in the last 60 years. We are way more sedentary than we ever used to be. And it's not what we're meant to do. We are meant to move. There's a saying in China which is, the main disease of old age is lack of movement. As soon as we stop moving, we really suffer. World Health Organization says that physical inactivity is one of the leading risk factors for non-communicable diseases, which is really chronic inflammation. Emotional health. Stress has gone up, so has loneliness and isolation. So Dr. Vivek Murthy, Surgeon General of the United States, is a fantastic man, in my opinion. He has a podcast called House Calls, is that it? Yeah. It's awesome. He's so good. But he's made it his mission. He says that actually loneliness and isolation is the modern world's epidemic right now. And it's like in the United States, I think it's over 60% of people identify as being isolated. Isolation and loneliness, the World Health Organization says, is like smoking 15 cigarettes a day. That's the equivalent of how that can impart inflammation into your body. So thinking about that, I think is really good. So isolation is one, anxiety, depression, stress, really, looking at that in a preventative way. One of the things to do is reach out to someone every day. Practice gratitude, even if it's just for a few minutes to say you're thinking about them and how good that can make someone feel, even just in that short exchange. Establish tech-free zones. We're trying to do this in our house. No phones at the dinner table. Let's connect as humans, and we're not, not like this. It's really important. One of the things about stress that I learned recently that I like is, when we're feeling that stressful moment, they say to go from a narrow view to the long view. So if you're looking at your phone, which is a narrow view, you're not going to get out of that stress. You need to put it down and look at the long view. And I think that's really good advice. So I'm going to get into some, so as I said, diet, counseling, exercise, those are really a part of the Chinese medicine toolbox. We're going to get into more kind of tools that are specific to Chinese medicine, like acupuncture. I'll just have a little bit about acupuncture. Studies are consistently showing it to be a safe and effective non-pharmaceutical treatment option for pain. So many studies are showing that people who rely on acupuncture for pain relief need less opiates, for example. So it's really helping with the opiate addiction crisis. I just read a study that's in its, I think, third stage of investigation of looking at using acupuncture in the emergency departments at hospitals now. So as an option to come in and get acupuncture on the spot. And it's coming out good, which I didn't ever think would be the case, but it's happening. So consider acupuncture for chronic pain. I think it can be a good thing before thinking about getting addicted to Advil every day or Tylenol every day. And we'll get into herbal medicine, which is really what I've done the most over the last 20 years. So herbal medicine in China, I was telling Peter before this talk, like Chinese medicine kind of got popularized in the 1970s, early 1970s, when Nixon and his crew went to China. And one of his administrators suffers with pancreatitis and was in a lot of pain. And he got acupuncture in the hospital in China and was like, what the heck is going on? And it worked, it helped him. And he came back, and then everybody wanted acupuncture. But the reality is in China, acupuncture is less than 10% of treatment. You go to a hospital, it's more than 90% of your herbal medicine. And so it got kind of reversed when it came here. With acupuncture, even the insurance companies, they're like, oh, we'll pay for acupuncture, but not for herbal medicine, which is very, backwards. In Taiwan, herbal medicine is part of your national healthcare system. Next slide. So herbal medicine is polypharmacy. So in any, I heard in garlic, a clove of garlic has something like 8,000 different chemical compounds in it. And we'll focus on inulin, one of them. But it's really, one herb is a polypharmacy in itself, meaning there's many different compounds in that. When you mix, in Chinese medicine, we rarely use one herb. We'll use a mixture of 2 to 20 ingredients that are cooked together, and they create this soup of medical compounds, and literally, there's going to be tens of thousands of them in there, and doing many different things. And all of those are going to be chosen based on the individual. So it's not like someone with, atopic dermatitis or whatever they have, all get the same medicine. They're all the medicine's gonna be tailored to that person and their choices, and those choices are gonna change as the person changes. So they're not even gonna take that same medicine for the duration of their treatment. A quote from the Su Wen, which is kind of the foundation of Chinese medicine, a text written somewhere, between 400 and 260 BC, whatever, a long time ago anyway. Different treatments for identical diseases. So that idea that you and I might have the same disease, but actually we need totally different treatment. And the doctor will determine that based on the signs and symptoms that you are manifesting. And so this is a quote from the British Journal of Pharmacology, 2006. I like it because they talk about, that because Chinese medicine is polypharmacy, that there's all these thousands of different chemicals going on. They can use it as a model to understand how the body works. Because Western medicine mostly has been, based on reductionists. It's one chemical, one receptor. It's really easy to study. But if you try to study how 10,000 chemicals are going to affect your body at once, it's really, really difficult. But when you look at it from this practice that's been going on for 2,000 years, and you see the progression of how someone has benefited from that, we can learn a lot. And if we go to the next slide, one of the things that we know, as I talked about with the polyphenols, is herbal medicines are loaded with polyphenols. That's what gives them their color. Like the color there in Huangqian, Scutellaria is yellow, which, one of the things that contribute to its yellow color is berberine. Berberine is a very well-studied chemical compound now, shown to be really good anti-inflammatory, particularly for bowel disease, for skin disease. But this idea of mixing different herbs together, so these three herbs here are commonly mixed together. I mix them all the time. Wendy will know I mix those three together. I think I did that this morning. And because they're so effective at helping with inflammation. So what we would do is, I would make a mix of usually not 3, but usually 12, 14, 16 ingredients that are then going to be cooked in water into, we call it the decoction, or in Chinese we call a tong. Tong means a soup, so it's like a herbal soup which you would drink, but it is disgusting. It's very terrible tasting. But it's loaded with all these chemicals and polyphenols. Okay, next slide. So I'm going to go into case A. Sorry, I feel like I'm rushing because I have so much. Is there a clock? Oh yeah, there's a clock. Oh yeah, okay, 15 minutes to do 5 cases. I could do it.
3 minutes.
So this is the part. So these are cases from my own practice. These patients allowed me to use their cases, for lectures, but please no pictures taking and that kind of thing. I don't want them all over the internet. We're going to look at the Chinese herbal treatment of atopic dermatitis, 3 cases, perioral dermatitis, which is a rash around the mouth, and then one of inflammatory bowel disease, ulcerative colitis. Okay, so let's start with this one. So here's a woman, atopic dermatitis. Dermatitis is also eczema, so those are kind of interchangeable names. Eczema and dermatitis. So you might hear eczema, you might hear dermatitis. Whenever you see the word itis on the end, it means inflammation. So it's inflammation, in this case, of the epidermis, the upper layers of the skin. Atopy means that the condition is related to a few other conditions. So we have asthma, we have rhinitis or hay fever, we have food allergy, we have eczema, dermatitis. All of them are related. Some people get actually all of them together, which is a nightmare of a way to live. Some will just get mild hay fever for a week when the cherry blossoms are always. But that's what atopic is referring to, is this idea that they're related to other allergic diseases. So this is a woman, age 50. She, like most people with atopic dermatitis, had it since she was a baby. Most people will get it before they're 1 year of age. Past 10 years, it kind of migrated and it's been primarily on her hands. It's very common. So usually, when children will have it in what we call the 4 crooks, or in Chinese medicine we call, what's the Chinese name? Su Wen Feng. Su Wen Feng. Wind of the 4 crooks. So it's a disease of the behind the knees and the inner elbows. But then as we age, a lot of people, it'll move from there and just end up on their hands. And a lot of people just have it on their hands. So that's happened to her. In the past year, it's been flaring more aggressively. It's been climbing up her arms and onto her face. She has a long history of using steroids to just, suppress it and get it down. But over time, she realized they weren't working as well, and she got afraid of the side effects, so she stopped. She tried other things, tried different supplements, dietary changes, and nothing was working for her. Same time, so when we look at this in Chinese medicine, what I look at a patient, I'm looking at, okay, what does the skin look like? What is it doing? As well as what is the general health of the patient. So in this patient, she just started going through menopause, so that's pretty significant of an event, as many women will know. But one of the things in Chinese medicine, the way I look at that is for so many of your reproductive years, you had this monthly detox. Things are coming out. And now that's gone. And what happens? And a lot of women who go through menopause, actually they develop skin disease. They'll get rosacea, they'll get other kinds of eczemas that'll come out more aggressively. They might have had it before, but it was kind of in remission, mellow. And now they go through menopause and here it comes out. That happened in this one. Her digestion kind of goes between constipation and diarrhea, more on the constipation recently. She gets a really strong thirst. She's hot and sweaty when she is sleeping. So those are significant in how I'll write a formula. You can go next slide. So as I just talked about, we take all the general signs and symptoms of the patient, including if it's skin disease, what the skin looks like, and then I use all that to come up with what we call a pattern. So it's like a jigsaw puzzle. I'm going, okay, I've got all these. Okay, this is how I'm going to construct my mixture of 16 herbs or whatever. Okay, so I made up a prescription for her. She took that as a tea, and she put some medicine on her skin for the next 6 weeks. So let's see what it looks like. So this is what she came to me like. She had been suffering like that for a year, and it was just getting worse and worse. So what happens if sometimes it'll just start off small, this little irritated eczematous spot. But if it's not managed properly, then it'll fester, and it'll grow, and it'll start spreading all over. Okay, next slide. So you can see it's on in the palms of her hands, going up her arms. And next slide. And here's 6. I don't know if you can see okay with the light. Is it okay? Yeah. Okay. Mm-hmm. So this is 6 weeks. So it's really calmed down. I mean, you still see it's dry, but all the weeping is gone. It's not as it was. Okay. Next slide. So you can see the comparison. 6 weeks. She'd been like that for a year, and there was no steroids in her medicine. Just the same. Next slide. Next slide. This is 12 weeks, so she kept taking medicine. So it just keeps getting better and better. She's just kind of minor dryness and skin. Keep going. Keep going. And then again, next slide. And then next slide. So she took medicine off and on for the next 8 months. And so, one of the concepts in Chinese medicine is this idea, like if someone comes in inflamed, that's when we call in the fire department. So that's where we go blast them with these medicines that are going to try to, get the inflammation out, get it to calm down. But then let's say that, if your house was on fire, that the fire was due to an electrical issue, and that electrical issue was due to rats in your wall, which has been close to happening to us. And but you're not going to call in rodent control and the electrician if your house is on fire. You got to get the house. You got to get the fire under control first. And so that's the way that I practice Chinese medicine. So we got the fire under control, and then so what she's done for the next 8 months is taken what we call kind of tonic medicine. So they're medicines that are going to help strengthen her skin and really promote blood circulation, or we call mop out all this inflammation. There might be all these inflammatory cells that are still in the skin. So we can use medicine that pull them out so that they have a less chance of having a relapse, okay? So we can keep going, and there we go, and there we go, and then we can keep going, and then and so I've known this woman, for years. Over the next 8 years, she had minor flares. One of the things that happened, I'll tell this story quickly. I got into Chinese medicine dermatology actually because of Jillian. Jillian, when we first started dating, however long ago, 24 years ago, is it? 25?
Almost.
she had really bad eczema on her body. And when we first started dating, I said, oh, you should try Chinese medicine, because I was seeing a doctor of Chinese medicine for my own health. And I hadn't really studied yet. And she said, no, I've tried everything. I've tried naturopathy, homeopathy, I've used steroids, I've taken oatmeal baths, nothing really works. I just have to learn to live with my condition. Fair enough. It's important to come to terms with what is going on for us. But it took a year of dating. We dated for the first year, and then finally she said, okay, I'll give it a try. She tried it, she took herbal medicine just like this woman, and within 3 months it was gone. Her eczema was gone for the first time in her life. And it was so profound for me and her family, everybody, that's why I decided to study dermatology. That's what led me into doing all of this. And when it first happened, I used to tell everybody, my wife was cured by Chinese medicine. It's gone. And I realized I was foolish. What really had happened is it just went into deep remission. And because 10 years later, when Teo was born, our middle child, he was born premature, 2 months early, and it was quite a stressful event. And then a little bit of eczema came back up, right? Joanne? Yeah. But it was only minor, not the whole body kind of thing that happened before. So this idea of helping the body to remember how to regulate itself. It's not perfect. It's not necessarily, I tell my patients, look, we can call it a cure if it never comes back your entire life. So on your deathbed, if it's never come back, then we'll say, okay, it was a cure. But really what we tried to get it into remission, or what I call where your body can really self-regulate. So she took medicine. This woman took medicine for a couple times, 2 to 4 weeks at a time, because she would have some minor flares that never really came back on her hands, and she did quite well. So I think that idea of getting the body to behave itself is really possible, and I think that the herb medicine can do that. Let's go next case. So this is a condition called perioral dermatitis. It is a new condition. We really only see this condition in the world they think starting around the 1960s, around when steroids came out and all this junk food came out. It actually is a condition that is one of the no-nos to use a steroid on, and it's commonly made worse. So a lot of doctors still do it to this day for some reason, even though it says in the textbook, do not use steroid. Or a patient, like in this woman's case, she had eczema on her hand a little bit, and then she got a little tiny thing out here. So she used her steroids. She used her hand right here, and then the next thing, and it worked. And then a few days later, it came back with bigger. Oh, and she used a little bit more bigger, and then all of a sudden it became this big thing. So our GP did the same thing. Gave a topical steroid in conjunction with antibiotic and fungal, mixing them in different proportions, and it all just made it worse. And you see all her health signs and symptoms. The main thing that stands out for me with her is she gets headaches often. She's taking Advil quite regularly, and she gets quite painful and clotted flow. So in Chinese medicine, those two things tell me there's something going on with her blood circulation. There's perioral dermatitis, very typical. It can get much worse. It can go over the whole face, go around the eyes, around the nose. But it had been like that for about 6 months, kind of fluctuating and coming back up, but pretty steady. Next slide. So she took herbs for 14 weeks, and it was like that. Next slide. You can see the two together. Next slide. And everything's normal. Her headaches went away, and as well, her menstrual pain went away. So that's very typical. I've helped, Peter said I worked at a fertility clinic. I did that for 4 years. I helped a lot of women with menstrual pain. That's a big key thing that we do. And often it's not just like an Advil for that one time. It actually helps them for many, many years after. Her skin, 2 years later, I still know this woman. She's a naturopath now, actually. She went on to study herself. And she sent many patients to me. That perioral dermatitis has never come back. The follow-up was 2 years after, but actually I treated her probably 11 years ago or something like that. So it's good. It really got her stable, and it stayed stable. Okay, next case. So now we're going into atopic dermatitis with topical steroid withdrawal. So I talked about this a little bit before. This is where, we're using a steroid, maybe too potent and too often. And then what happens is the body becomes quite dependent on it. That dependency is real, and it's becoming well known, and that's what the Dermatology Society in the United States flew me down to talk about. It's like they need options other than just using a steroid. What can we do? Or an in-between place from a steroid to being put on really strong immunosuppressant medicines that they might take their whole life. So Chinese medicine, I think, can be a good option. So this is a woman, typical again. She had atopic dermatitis since she was a child, mostly grew out of it, and then she'd only get small patches from time to time. This time she had a little bit, just on her eyelid, just a little bit on both eyelids. She actually had a steroid, Dermavate, which is quite a potent steroid. Should never be used on the face, especially the eyelids. The eyelids are some of the most sensitive part of the body. But she didn't know. She actually, I think she got it from her mom. She just used it, put it on there. So we talk about misuse. She used it for a whole year. It helped. And then she kind of looked into it a little bit and said, oh, this is a really strong steroid. I probably shouldn't be putting this on my face, or especially my eyelids. So she stopped cold turkey. Within the coming days and weeks, it actually went over her whole body. And then, went to her GP, they put her on prednisone, cleared it up, and then within a week, it was just right back. And so, we'll look at her case now. So this is 10 months after, so all her signs and symptoms. She's pretty healthy, she's 33, she's like an athlete, using just cold water and coconut oil to give herself relief. The thing that stands out for her, she's 33, but she's waking twice in the night to pee. And I wouldn't expect that so many times in a woman of her age. So in Chinese medicine, the way I look at that is she has this lot of heat in her body that's accumulated, and her body's trying to get it out. And urine is a good way to get it out. So we can go to the next slide. So that's her face there. So that's just, it blew up like that just from using a steroid on her eyelids. Too long, too potent. And then stopping, it just exploded. Yeah, just keep going right through. So by the time I saw her, it had already been starting to calm down. It was just more on her upper body, as we'll see. So her back, and a little bit on her arms, but it had been more full-blown. 12 weeks of herbal medicine, not waking in the night to pee anymore. And her face is getting quite clear. We can keep going right through. And yeah, so she only took medicine for 12 years, and she stopped, 12 months, 12 weeks, and then she stopped. And then I checked in on her about a year later, and she just had a couple small patches of eczema. They usually self-resolved, and she never used any herbal medicine or steroid. I don't think she'll ever use a steroid again, but any herbal medicine from me anyway since that time. So again, we get that kind of fire out and then to stabilize. That's the main thing, and I think that's the thing that a lot of what we've struggled with modern medicine is we can get the fire down, but we can't get it to stabilize without being dependent on a medicine. And so the ability to get the body to self-regulate is really important. I really think that a lot of the self-regulation, and there's growing evidence of this, tons of research coming out, is that because of all these polyphenols in the plants, it's actually what it's doing to regulate the bile. And it's really playing so that the body can develop butyrate and all these wonderful things to get things to calm down, rather than relying on just one single compound. Fourth case, this is a 10-year-old girl. This is a really sad case. She came to me, typical, had it as age 2, kind of late actually. For atopic dermatitis, it started age 2. We often say that's a poor prognosis, meaning be more stubborn if it's past 1 year of age when they first get it. Relied on topical steroids, stronger and stronger versions of it. Mostly just had it in her creases, and just more and more potency was needed to keep it under control. A year before coming to see me, 2 years before coming to see me, she, the mom was getting frustrated and said, that's enough, let's just stop the steroid. Again, within a week, she went full-blown, whole body. When it was just here, now it's everywhere. Got constant infections. So what happens when the eczema comes up, part of its progression, it goes from really dry, flat to really swollen and then oozing. And once it oozes, you're really prone to infection, like staph infection, streptococcus infection. So she was on multiple rounds of antibiotics, and it just kept getting worse and worse. She was pulled from school because it was so bad. And when she came in, she couldn't move her arms. She came in like this, and then sat down. You can see her picture. Yeah. So this is her face. We go. So yeah, she couldn't move her arms past that. She was kind of stuck like that. You can just see it's really inflamed. Her arms, her legs. Again, this is really common. We call this red sleeve. So one of the things that's unique to coming off of a potent steroid, and you have this kind of reaction, is that it will go right to the the dorsum of your foot and hand and stop there. And the hands will be, the feet will be fine, but so they call it red sleeve. And she didn't have eczema there before. She just had it, in this area. But again, she couldn't move her legs. It really, whenever she'd do, the cracks would just, cracks all swollen. So 14 days, 2 weeks, everything's starting to calm down. She's calming down. So you can see things are clearing down. And what happens, the skin will get a bit dry because this is all swollen. There's so much moisture built up in the tissue. As you go, you can see how it gets a bit flabby in here. There's all this swelling, and then when it comes down, the skin is a bit flabby. You go through, you see it's calming down. There's a bit yellow in there in the picture because one of the herbs we use is quite yellow that we put topical. Getting better. Can straighten her legs better now. And then 8 weeks, so 2 months on herbal medicine. She had to go down to 1 pouch a day because she was getting some digestive upset. So that's one of the side effects we might find with herbal medicine for some people, is it might upset their belly. Sometimes I can fix that by my herb choices, but not always. And in this case, they just went down to half a dose basically of medicine instead of twice a day. She took it 1 day.
And this is just oral therapy, no local therapy?
There's topical therapy too.
Topical?
Yeah,
as well.
one herb, Huanglian coptis, which again is kind of a yellow color, that she would use periodic. It's quite messy, so most people will use it for a period of time and stop it because it's so messy, and that was the case with her. And then, yeah, we can go, and you can just see, this is after 2 months, 8 weeks. Keep going. And you can just see it's much healthier. A lot of that eczema is really out. You can see the red sleeve like I talked about in there. Now it's much better. It's not perfect. And then what we see, a lot of the brown is what we call post-inflammatory hyperpigment. So whenever you have strong inflammation in the skin, it's going to dysregulate melanin production. So you can either end up with lighter white skin, which we'll call post-inflammatory hypopigmentation, or too much, which is post-inflammatory hyper. So she gets a lot of hyperpigmentation. That will go away. Given enough time, that will regulate and go away. But yeah, you can see the difference there. You see, this is mostly post-inflammatory hyperpigmentation. She can straighten her legs, she can walk. Yeah, so at 12 weeks, I checked in, and they were super happy, decided to take a break because it was too terrible tasting. Like I said, it's really hard to get kids to drink herbal medicine, I'll say that. I have 3 kids, and I know full well. Everything, all their digestion went back to normal. I had loosened a little bit. So one of the things that might happen in herbal medicine that we look for in Chinese medicine is called comfortable diarrhea. That's where the stool might become a little bit looser, maybe a little bit more volume, but comfortable. There's no cramping. It's not explosive diarrhea 10 times a day. Because it's a bit of a way to cleanse. You imagine all that inflammation. Those are all inflammatory cells. Those are things that actually need to go somewhere. And so through the stool is a good way. I still know this patient. She's 17 now. She, over this past 7 years since she stopped, she's had minor flares of eczema. Again, it's a lifelong condition. Atopic dermatitis is your whole life. If we can get it into remission and stay there, awesome. But if at the least we can do is just to make it more minor, so your quality of life is better, you're not walking around like that, and go back to school or whatever, then that's good too. She's never used any steroids ever again, her mom never will. And when it's come back, it's just come back in her typical areas, just a little bit here and there, usually comes down. Okay, last case, there's no pictures for this one, but this is an inflammatory bowel disease. Like I said, the projected statistic on this right now for 2035 is that more than 10% of the population will have this ongoing. And it's like a thing. Again, I think it's related to how we eat and eating way too much reliance on industrialized foods. We need more plant foods in our diet. So he's been suffering probably 20 years with this. He tried all kinds of things, including steroids, and some would work and come back. He was on mesaline, acetol, suppositories every day, and typically that would help somewhat, but this, for the past few months, it was not helping at all. He was being encouraged to go back on stronger immune suppressant medicines, but he declined. He didn't want to do it. So he went and saw actually I think it was a naturopath that said, oh, he needs to eat more fiber. So I just talked about eating more fiber. But the reality is when you're flaring with inflammatory bowel disease, you do not want to eat a lot of fiber. That's the time when you actually want to eat less fiber, because the fiber is like sandpaper. So ulcerative colitis is like having big wounds in your intestine that are open. And if you eat a lot of fiber, it's just going to be like sandpaper scraping them. It's going to make you worse. So I told him, you have to stop that. This is the time you can eat white bread. But this is a medical diet, and I want you to eat that. Once you're better, stop. So he took 3 months of herbs. You know, I changed it every couple of weeks, his medicine. It's not the same prescription he had. He went on a low fiber diet, like I said. Everything, even fruit, he had to cook, like apples and pears. You don't want much raw fiber that's going to, scrape these wounds. Everything went down. He went, in 3 months, he went down to 1 or 2 bowel movements a day, no diarrhea, no pain, no mucus, no bleeding. And he was also decided, along that journey, he stopped the acetol. He has sent many patients to me for the past 12 years. He's never taken herbs from me ever again, and he's been stable. He writes me, he says, oh, I was even able to eat, pizza, and I didn't even suffer, or maybe I had bad gas, but I didn't get, this. So I really do believe, again, the herbal medicines aren't magic. What they're doing is they're really helping to repopulate the diversity and the function of our microbiome. I really believe that's what's happening, and I think that's what the research is coming to more and more and more again. As we said, this is all new knowledge for all of us, understanding what's going on. The treatment of inflammatory bowel disease is not new in China. I mean, they have records of treating IBD type of conditions from 2,000 years ago, and good effects. So the herbs I used have been used for a long time, but our understanding of microbial action and what might be happening, what these herbs might be doing, is really, really new. And I think it's really exciting. I think in Western medicine and Chinese medicine, all of this coming into understanding how to nourish this rather than like, oh, you're sick, oh, just take this pill. And meanwhile, this thing is still festering, and we don't, to go, no, we have to nurture this. Then your body can self-regulate, as it did in all of these patients. I think it's very exciting. Just a couple more slides. These are just quick modern research ideas, just things they've done in Western science. It's hard to study Chinese medicine in Western science because we don't rely on one chemical. So because I'm changing prescriptions all the time, it becomes harder to study. But they do have some good studies, showing really, these studies were set up in London, England, I think in the first one is 2007, the other ones are in the 1990s, where they gave medicine without changing it, so just a standardized medicine, and still saw a really good effect. Ulcerative colitis, a really good effect. Again, I put in there because of how they think it's modulating the gut microbiota, the gut microbes. And then the next one. Oh, and this is another study. So this is a study where they looked at the doctor individualizing the treatment. So meaning they're changing the herb selection throughout the treatment rather than just giving them the same prescription the whole way through. And again, they found that the green line is where they just used the steroid, and you can see it's kind of even medium through the same thing. It improves, and then it kind of comes back, and then it hovers in this kind of place. On the herbal groups, the SCORAD score is kind of looking at your whole body, measuring how much is there and how it's improving. It got better. Quality of life score got better, and then the patient assessment of themselves all improved on herbal medicine. Whereas the steroid group is all kind of, it tends to flatline, which is pretty common. It works really well, and then it just kind of stops, and you kind of hover in this spot. And I think that's it. So just to conclude, I'm 10 minutes over. Inflammatory diseases have been rising over the past 60 years, and I really do think this is due to our heavy reliance on ultra-processed food. We have been sold a myth, and these companies have big psychologists to trick us into eating Fruit Loops and thinking it's okay. And now they do, here's a power bar, and it has added protein, and meanwhile, what else is in there? We have to be really careful. Plant-based diet is the way to go. The variety, 30 plants per week, lots of color. We have to get out of this mindset of just suppressing. This idea of just suppressing just is really good for pharmaceutical companies. It's good for patients if it's the only thing that proves to work. I tell my patients, look, if the steroid's not working for you anymore, your next option is what we call biologics. Biologics right now in Canada are $6,000 an injection, and usually you need one a month. Like, who can afford that? Unless your insurance pays for it. And the thing about it, it's for life. It's not the kind of medicine, it's like, oh, I'm better now, I'm going to stop them. Because if you stop it, what will happen is your condition will come back, but you won't be able to use the medicine again because your body develops antibodies to it, to what I understand. And so it's a very tricky place. They're good medicine, biologics. I have a lot of Western medicine doctor friends in Europe where biologics are covered, and they're saving lives. They're really good. I mean, I don't want to minimize how difficult these conditions are. They're really deadly, and so we're really lucky to have that. But I look at it as the upper tier of the ladder, and then what's in the middle? Well, if we can use something like herbal medicine, and they take it for whatever, 3 months, 6 months, and it can get a condition under control such that they don't need to even use medicine anymore, only need a little bit from time to time, then that's much better than getting someone addicted to a medicine for the rest of their life. But if the herbal medicine doesn't work, well, then that's awesome we have that. It really is really good that we have these remarkable things. But again, they're all based on this idea of suppression. So we need to go outside of suppression and understand what are some other things that we can offer that can help the body to self-regulate. Thank you very much.
I'm sure there's questions.
Yeah, please.
Teresa,
you moderate.
I'm just wondering, for that little 10-year-old girl, when she didn't like the taste of the medicine, can you grind it and make pills or put it in capsules?
You can. So there's so many different forms of how to make the medicine. For years, I used to have pressure cookers, and I used to pressure cook the medicine. So that 10-year-old, that's what she had, was medicine that was pressure cooked in a pressure cooker, and then put into little sachets that they open and drink. And that's considered kind of the gold standard. It's going to get the most medicine out of those plants. And but it's really time-consuming way to prepare the medicine and costly. But yeah, there's pills, there's capsules. When you start going to pills and capsules, you're just looking at weakened efficiency. And so really, the majority of efficacy in regards to being able to get that medicine out of the plants comes through cooking in water. And so just like a super stew or a good curry, it's this synergy of all these things together that make it's the sum of the parts. The whole is bigger than the sum of the parts, and because there's these new chemical compounds that are being created through water and heat and time. So if you just put things in a capsule, you might miss that. We might miss some important things. So I have some companies that will capsulate my formulas for people when they're traveling, but I don't find them as effective. The best is water cooked, or we call it tom.
question right here.
I was just wondering, in terms of your Chinese medicine and teas that you're making, where are you getting all your plants from? Because a lot of the plants are from China,
That's
not
right.
here.
That's right. Yeah. So that's a big topic, and I'll talk about it a little bit. So what I practice, Chinese medicine, are based on herbal medicines that are, have been grown for thousands of years in one particular place. So what they've done is they've done studies where they'll take that same plant and grow it in a different region of the planet. And then I have a friend actually did his PhD in Seattle on plant chromatography, just chromatography to look at, okay, here's this plant from its traditional region in, say, Sichuan province, and I'm going to grow it in Seattle. And then what we're going to do is we're going to look at the chemical compound profiling of it with this chromatography and see if there's any difference. And unfortunately there is. There was a big difference. So it's almost like taking that plant that is locally grown, it's like a whole new plant to understand how to use. Okay, so it might not fit into the system as I know it in terms of prescribing. It doesn't mean it's not good. But that's a whole area of study, and there's lots of people throughout North America trying to grow herbal medicines in a large-scale way for doctors like me to use effectively. But that's another topic. Right now, I do get my herbs from China, but I took a long time to find good sources. So I have a source that tests for herbs to be free of pesticide residues, heavy metals. They do species analysis to make sure it's the correct species. They're very fresh, they're vacuum sealed, so you open it and you get this blast of fresh smell. As compared to Chinatown, unfortunately, if you go to Chinatown, often, a lot of the shops in Chinatown are run by people who they're not even doctors of Chinese medicine, they're just businessmen. They have connections to usually Hong Kong, and then they'll get the cheapest of the cheap herbs that have been sitting on a shelf for, years sometimes, and then they'll sell them here. And you open it, and it won't smell fresh, it'll smell awful mildewy. And so quality is really important, for sure. Quality as well as contamination, so they're very important. My dream, when I first started studying herbal medicine in the early 90s, was I'm going to grow my own medicine. I'm going to wildcraft them. And that's what my first teacher was Dr. Terry Willard. I don't know if anyone knows who he is, but he founded the Wild Rose Herbal College in Vancouver. That's where I went. And he, and he was a wildcrafter. He said, the best way to get to know the herbs is to go and live with them and harvest them and be with them. And that's what I did. When my daughter was born in '95, I was living in the Kootenays in Argenta, doing a lot of harvesting of my own medicine. But the reality is, I import more than 6,000 pounds a year. There's no way I could ever, and I have a small practice, there's no way I could ever harvest or grow enough myself. And so, I use probably somewhere around 300 different types. So it really is it's a big topic. So my way right now to settle my own crushed dream of growing everything myself is to find really good sources. And so the source I have right now sources for most of Germany. So in Germany, the government is really strict about what they import in. The Germans have some of the highest standards for the organic movement in the world. And so that's where I get most of my medicine.
Trevor, we didn't talk about the economics of this.
Yeah.
And so it's not covered by our universal
system.
healthcare system.
Well, my consults are. So
Your consults?
Yeah, so often people have their consult covered, but they won't cover herbal medicine.
Okay.
And that can get costly. So, people seeing me on average, if they're taking herbal medicine, are probably spending $300 to $400 per month on the medicine itself. Yeah.
So,
In the States, they may be spending close to $1,000. Yeah.
so the way to get it covered is to prove efficacy.
That's right. Yeah.
Like pharmaceutical companies have to do clinical trials
That's right.
and prove efficacy, and then you can get the government to pay for it.
That's right.
So you mentioned a few clinical trials, but why aren't there big, powerful clinical trials to show that these things are effective so we can get them on the public healthcare system?
Well, I think that there are some going on. So and so a few things. That's a quite a big topic. Is clinical trials. So one of the things is having experts involved in the research. So if it's, say, treatment of atopic dermatitis, having someone who has 30 years of treatment experience treating atopic dermatitis, rather than someone who just graduated from university and now I'm going to be part of the study and treat atopic dermatitis. That might work in Western medicine because you're just relying on the disease name. Like, this is atopic dermatitis. Okay, we'll just give this drug. And so as long as they fit into what is atopic dermatitis, then they apply. Whereas in Chinese medicine, it's atopic dermatitis, but it's atopic dermatitis, due to all these different subtypes, and so it's very individualized. So the individualization of the medicine, in combination with the expertise of the doctor themselves, because like in China they call, we used to call the old doctors, we call Lao Shi. Lao Shi means old doctor because they have all that experience, and that experience really is years and years of seeing 50, 60 people a day in a hospital setting, individualizing their treatments.
So it would have to be a clinical trial of some experts.
Yes, that's right.
Versus Western medicine.
Yeah.
And then it would be impossible to make that double blind.
It becomes, well, that's what the last study I showed you, that's what they tried to do. So they had like oral placebo. So my teacher in Britain has been involved in some of these where they'll make like a herbal soup, but it's really vegetable soup.
Okay, so there's a control.
They're trying. That's right. There's some controls, and then they can do all of the changes in that way. I mean, the studies that they've done on where they don't change it still come out good. They're just not as good as if they've been individualized, and in terms of the long term. But that's a huge topic, and so the other thing is there is a translation piece missing, right? So from what is happening in Asia versus what we see here. So we have PubMed, the big database for all the research, and some studies from Asia are translated into English, but many aren't. So China, for example, has 2 or 3 of its own versions of PubMed.
So there may be data out there that we just don't have.
Oh yeah, I'm sure there is. Absolutely, there is. That I can't even see because I'm not fluent in Chinese. And so I think that data is there, and definitely trials could be set up better. But those are the parts. So that's why in Chinese medicine, they go back to case studies. So the fact that, we look at doctors. So what I've learned from a teacher who learned from a teacher who learned from a teacher, and then I can do that, right? And that's undeniable. So I tell people, look, if you really want to see Chinese medicine, clinical trials are definitely a good thing, and hopefully that will happen, or is happening. But really, go sit with a doctor in China for a month, and watch them, and watch their patients come in, and document them. And like when I followed this doctor in China, in the dermatology ward, 50, 60 people, 70 people, 6 days a week, and he could do both. He could do Western medicine and he could do herbal medicine, from mild to severe skin disease. And the only time I ever seen him write prescriptions for Western medicine was for toenail fungus. Because it's so
doesn't
stubborn.
work either.
Well, the internal does, Lamisil
Oh,
can, but can be really toxic.
Yeah.
That's right, exactly. But it's a big thing. It's a tricky thing to navigate and to do it properly, because then you get into also herb quality, making sure the herb quality is good, how it's prescribed, what's the expertise of the person prescribing, and then and is it individualized? How are they classified? Like the whole. If you go and look at research, there's tons on PubMed. That's where I get these ones, and they're good, but there's still challenges there. There really are. Yeah, Western medicine is much easier to study.
Yeah. Any other questions? Oh, Carol, and then Marie. Carol first.
I just have a question about, this is related to ulcerative colitis. If somebody is on biologics, and my son was on biologics for years, different kinds, ended up losing his colon. But one of the things that got suggested was that he try Chinese medicine. Our family was saying that. So I can't go off biologics and do, I just can't take that chance.
Yeah, yeah.
Do they ever treat
Together? Oh yeah, for sure. You know, I have experience in doing that. Not very much. I usually like people to be on one or the other, and but I have had patients where I'm doing both. Like some people on biologics is still not perfect, and so then we'll use the herbal medicine as the kind of the fill-in gap, you know, to go, okay, well, what can I do in conjunction? But that's a huge area throughout the world, in China especially, where they're doing the mix together. And I have, so in Europe, where I trained, after China, I went to London, England to train with one of the Western world's top Chinese medicine doctors of dermatology and inflammatory disease. And IBD is it's like half his practice. And a lot of his students, my colleagues and friends, are Western doctors. So they're doctors that practice, you know, they're like the, whatever, respirologists, they're a dermatologist, gastroenterologists working in Germany, Switzerland, all throughout Europe. But so they can do both, but a lot of them have switched over. Some of my colleagues have switched over to 98% Chinese medicine now, working in hospital settings. But they have access to doing things like regular blood tests and just to really monitor how well they're doing with these two types of medicine at the same time, which is what I would lack, you know, that ability to.
I think it's expense too with the biologics, and companies will often support people
Oh yeah.
if they're on it, but they don't want, that's what he was.
Oh yeah, biologics are, I mean, they're life-saving medicine, but they are really, I've seen lots of stories on biologics, but they're really expensive, for sure. I mean, her medicine is expensive. Her medicine, I get the highest quality you can get pretty much on the planet, and I keep it down to a minimum because I have one helper, Wendy, and it's in the pharmacies on my property. But I know a lot of people who run pharmacies throughout the world, and they always gawk at how I can get away with not it being as expensive. Like I have patients in the United States, for example, I'll send my prescription to a pharmacy down there because I don't want to ship it across the border. And they'll say, oh, it's like $22 per day or whatever. It's like very expensive. So herbal medicine is expensive, and it would be nice if it was covered, for sure. It is in Taiwan. I mean, the Taiwanese.
How about Germany?
In Germany, to some degree, yeah, I think so. Switzerland, I think to some degree, yeah, there is some coverage there. That's right. Yeah.
Marie had a question.
I've been under the impression that raw food is, you get more nutrition from it.
Yeah.
But I'm hearing from you not necessarily.
No. Just to back up a little bit. I think raw food is awesome. I have a salad with probably 12 different ingredients in it almost every day. I think is really good. Especially in our modern world, we have access to some of the best vegetables you can grow yourself or buy at a good supermarket. What I was saying about the ulcerative colitis case, the inflammatory bowel disease, is when you are flaring. So what inflammatory bowel disease means is that you actually have these ulcerations in your intestine. There's these oozing sores. That's where the bleeding's coming from. It's terrible, painful. If you have too much roughage, like raw fiber, for example, raw food, it can act like sandpaper. So it's just too much, and it goes through, and it causes a lot of pain and discomfort. And so generally, during a large flare, and a large flare means you're having, say, more than 10 bowel movements per day, then that's the time where we call it a low residue diet, or low fiber diet, where, you know, fruit is kept to a minimum. If you have fruit, you cook the fruit. You really limit whole grains, don't eat any beans. Everything is really, you know, well cooked. And vegetables are cooked just to help, to assist in that digestive process, to soften the fiber. And then once it heals, then usually, yeah, I think raw food is really good. But I would say I would have a mix. I'm not a raw foodist. I tried raw food. I was a raw foodist in my 20s for a little while. I think I weighed 120 pounds. But I think having a large amount, like we grow our own red peppers, for example, you know, our sweet peppers. We grow quite a lot of them, and there's no doubt that, you know, like a pepper has something like 10 times more vitamin C than a orange. You know, it's so good for us, especially when it's ripe. It got red or orange in it. And that vitamin C is going to be a lot destroyed if you cook it, you know. So I always throw some pepper in my salad. But just to clarify that my saying about the raw food or whole grains, all these kind of things, is more therapeutic for a short period of time when someone is in a flare state. And then other than that, I think this is what you want. You want lots of fresh food, including raw.
Okay, well, I'd like to thank Trevor very much. He's obviously a lot of interest. And I'm just wondering when it's going to open up again at our clinic.
Well, I'm at Hope Bay. I'm working out of Krista's office,
Okay.
the massage therapist, mostly because I can ride my bike there.
Okay.
If I live closer to the health center, I would be back down there. Maybe I'll go back down there. Maybe Krista has a nicer view. So. But I'm there on Thursdays right
Okay.
now. Yeah. I've done this since 2005. Focused a lot on inflammatory disease.
But mostly in Surrey, right? You're in
South Surrey. That's right. And I'm still there. I still have a clinic in Jillian's same building where Jillian is. But I've been kind of moving back into going to do more acupuncture, just more for pain. So I've been training in the last while in what we call sports acupuncture, so relief of tight muscles and that kind of thing. And that's what I'm doing a lot in Hope Bay. But I still do this as well. But yeah.
Great. Okay, well, thank you again.
Thank you.